Have you ever noticed how a medical condition you've literally never heard of suddenly seems to be everywhere? Well, today we're going to dive into the fascinating story of Restless Legs Syndrome and how one company's marketing genius turned an obscure ailment into a billion-dollar industry.
It really all kicked off with this press release back in 2005 from the pharma giant GlaxoSmithKline. All of a sudden, this condition that most people, and honestly even a lot of doctors, had never heard of, was being framed as a national sleep crisis.
And the scale of this supposed crisis was just staggering. The campaign wasn't suggesting that restless leg syndrome, or RLS, was some rare disorder. Nope, they were claiming it was affecting as many as 1 in 10 Americans. We're talking potentially tens of millions of people. So you have to ask, right? How did a condition that was barely a blip on the medical radar suddenly become so widespread, seemingly overnight? Was this some new plague we'd never seen before, or was something else going on entirely? Here's where it gets really interesting. RLS wasn't new at all, not by a long shot. In fact, it had been documented for centuries, just kind of hiding out in the footnotes of medical history as this weird, mysterious condition. The first known description? That dates all the way back to the 1600s. It was formerly characterized in the 1940s by a Swedish neurologist, which is why you'll sometimes hear it called Ekborn's syndrome. But here's the kicker. Even as recently as the early 2000s, most doctors still considered it a very unusual condition. It was real for sure, but they thought it was rare. And let's be super clear, RLS is a legitimate medical disorder. According to the National Institutes of Health, it's a neurological condition with these very distinct, deeply unpleasant symptoms. We're talking an uncontrollable urge to move your legs, often with this creepy, crawly sensation. So the condition is absolutely real. The real question was about its prevalence.
Okay, so this brings us to the business side of the story, and a company called GlaxoSmithKline, or GSK, and their drug, Requip.
See, Requip was already a successful drug used to treat Parkinson's disease. But Parkinson's affects a relatively small number of people, which, limits the market. GSK started to notice that some doctors were prescribing Requip off-label for RLS, and a light bulb went off. They realized they had a huge opportunity on their hands if they could get it officially approved for this other condition. The challenge? The market for RLS was tiny.
So what do you do when you have a drug for a little-known disease? You don't just market the drug, you market the disease itself. This is a strategy known as disease branding, where a company works to raise the profile of a condition to create a larger market for its treatment. And in this case, GSK basically wrote the playbook. And this wasn't just a simple ad campaign, it was a sophisticated, multi-channel strategy. First, they targeted doctors with articles in medical journals, raising awareness even before the drug was approved for RLS. Then came the massive public relations blitz. They used influential medical experts to educate general practitioners about the condition. And finally, they went directly to consumers with TV commercials that asked, "Do you have trouble sleeping? Maybe it's RLS." The effect was so profound that the Wall Street Journal was commenting on it back in 2006. This quote really says it all. GSK's marketing machine wasn't just selling a pill, it was selling the very idea of RLS as a common, treatable condition. And the results? They were staggering, both in terms of financial success for the company and the intense scrutiny it attracted from critics. Let's just look at the numbers for a second. In 2005, the market for treating RLS was worth just a few $1,000,000. A decade later, after GSK's campaign, it had exploded into a $1.7 billion industry. That is a mind-boggling level of growth. And this wasn't just about money. The marketing had a direct impact on patient diagnoses. The number of people being treated for RLS skyrocketed, going from under 400,000 in 2006 to over 2.2 million by 2015. So this created a really complicated legacy. On one hand, you have a massive business success story. Requip made billions, RLS became a household name, and millions of people who may have been suffering in silence got treatment. But on the other hand, the criticism was fierce. Accusations of disease-mongering, basically medicalizing normal life to sell drugs, were everywhere. Some even called RLS a concocted disorder. This leads us right to the heart of the debate, a question that's still so relevant today. Was this a noble campaign to raise awareness for an underdiagnosed condition, or was it a cynical exercise in creating a market out of thin air? There are two really distinct sides to this argument. You have supporters, including a lot of patient groups and doctors, who praised GSK.
They argued that countless people were suffering from a real disorder that was finally getting the attention it deserved. But then critics argued that GSK had simply taken common experiences like occasional fidgeting or trouble sleeping and turned them into a disease for profit.
GSK's response from its head of pharmaceuticals, David Stout, was pretty direct. He argued that it's easy to trivialize a condition that ruins people's lives when you don't have it. His point was simple. If the suffering wasn't real, people wouldn't be seeking treatment. The demand, he claimed, proved the need.
And that leaves us with this final crucial question. With so much advertising for medicine aimed directly at us, the consumers, where exactly is the line? How do we distinguish between an ethical campaign to educate patients about a real illness and a marketing campaign designed to create patients for a drug? The story of RLS doesn't give us an easy answer, but it forces all of us to ask the question.